Hello, my name is Curtis Crane of the Crane Center for Transgender Surgery, and I'm both a board-certified plastic surgeon and a fellowship-trained reconstructive urologist. Today I'm talking to you about zero-depth vaginoplasty. This is a surgery where we create the external appearance of female genitalia, basically the vulva, but no vaginal canal. This is a great procedure for someone that is not interested in being penetrated vaginally with sexual intercourse. That's really the only reason to have a vagina in this community. And so if that's not something that interests you, then you really spare a lot of recovery, downtime, and risk of the surgery by not having it. We still create a clitoris, clitoral hood, labia minora, labia majora. We can do all of that in one surgery. Through my combination of being a urology resident for 6 years, a fellow in trauma and reconstructive urology for a year, then becoming a fully board-certified plastic surgeon with a fellowship in transgender surgery, we are excellent at both the aesthetic result and the function of the vulva. Even though you're not having a vaginal canal, you still want to urinate hygienically. And so that's where the function comes in. The first time I ever did a vaginoplasty was probably in 2004. So at this point, I don't know how many hundred we've done. But through my combination of training, I was fortunate enough to go all over the world and see various vaginoplasty and zero-depth vaginoplasty surgeries. I watched surgeries and participated in many in Thailand, Belgium, Amsterdam, Holland, and Serbia. And then also saw several surgeons in the US perform these surgeries. And so what I did was I took sort of the best parts that I felt like were from each surgery, and then I just developed my own technique that we employ now. As I mentioned, it's a one-stage procedure. However, about 20% of our patients want a little touch-up on the clitoral hood. Sometimes that can retract a little bit as patients scar. There can be minor asymmetries from one labia to the other. If a patient would like that corrected, it's typically no problem. As I mentioned, the downside, or the time away from work, recovery time, is a lot less in zero-depth vaginoplasty, just because we don't have to dissect up into the body to make that vaginal canal. Most of my patients take anywhere from 2 to 4 weeks off of work. If you have a job where there's some manual labor, then closer to 4 weeks would be better. There's no dilation protocol because there's nothing to dilate. This is an outpatient procedure. We perform the surgery and it's safe for you to go home. And then we typically see you back the following Tuesday in clinic. The risks of the procedure include infection, bleeding, wound healing complications, changes in sensation. However, sensation in the clitoris I have found is excellent. I haven't heard any of my patients say that they can't orgasm. Nerve damage is always a risk, but I know right where all the nerves are to the clitoris, and I haven't had anyone complain of loss of sensation once everything has healed. There can be some loss of sensation around any suture line because there's microscopic nerves in the skin that get cut with surgery that you can't even see with an operating microscope. If those get cut, then there can be some numbness around those incisions. We make a very aesthetically pleasing vulva with a zero-depth vaginoplasty. I use the mucosa from the urethra to create the nice mucosa in between the labia minora, which gives a very realistic result. And like I said, our patients are typically back to work, their normal lives, quicker than if someone wants a zero-depth, just because it's less surgery. The complication rate of damage to the urethra, the bladder, or the rectum is pretty much non-existent because we're not forming the canal like in penile inversion vaginoplasty. There will be a small little dimple where the vagina would be. I find that aesthetically that looks better. And the other risks that I mentioned, infection, bleeding, wound healing complications, nerve damage, all those risks are less than, I would say, 2 to 4% in my hands with this surgery. If you have any other questions on zero-depth vaginoplasty, please feel free to ask me in your preoperative consultation, and we look forward to seeing you. Thank you.